two.
Take two. So, and on a serious note here, you know, the esophagus, which we see sort of coming beside the aorta, running through the chest cavity, the tube at the back here. It's not really that well dissected out, but it's this. It's pretty big. It's this. It's just against the back body. Well, it's bigger.
Sorry.
No,
Let me just make
Like
sure.
breathing on you.
You really want to?
You want to see?
Here.
It's fine.
So there's the esophagus,
I saw the
and it goes right to the diaphragm, right? Here's the diaphragm. And immediately on the other side, no more esophagus, because there's where the stomach, right up against the diaphragm, has that entry of the esophagus into the diaphragm, which would be?
The duodenum.
No. The orifice or the sphincter, where the
okay.
cardiac.
Yeah.
Yeah,
cardiac.
cardiac sphincter.
And you know, I don't know if I said this in lecture, but you know why we call that the cardiac sphincter?
Because it's supposed to.
Because you
Yeah,
get the
'cause
heartburns.
the heart's sitting right on top of it. Yeah, and heartburn,
That's where you get the
right?
heartburn
If you
from.
get
Oh, okay.
if you get that type of indigestion that feels like it's almost burning in that region, or sometimes people feel it actually in their heart, because we can't really, you know, we don't have that ability to localize things like we do in the outer or parietal or somatic part of our body. So we sometimes get these referred pains, and so we call that heartburn. And of course, the problem is, how do you tell a heart attack from indigestion, right?
The
And so I can tell you, there's plenty of.
radiation.
Well, no, that's right. Well, the way you know you have to do a. Help me out here. What do you call the thing where you look at the key? Yeah, thanks. My mind is at a blank at this point in the evening. An EKG or some other diagnostic test, and you know, believe me, there's plenty of people with indigestion who, you know, you go to that's the one, you know, especially if they're arriving to an emergency room, that's the one scenario you have to go to that needs urgent care. So anyways, that's all in hopes that you'll remember that that's the cardiac, you know, sphincter or orifice going into the stomach. And then the way I like to remember this, you know, is that if we think about, you know, I think people are aware there's 4 quadrants, right? With your belly button or umbilicus right at the cross between the quadrants. So you have upper right, upper left, lower right, lower left. And the stomach is a J. You know, it's a big fat J. But if you want to draw a J on here and come down and have it continue, you can't do it on the right side because you'll, you know, wind off to the side of your body. So the stomach's in the upper left quadrant as a J. And then the duodenum comes off as a C in the upper right quadrant. So here, you know, there's the J of the stomach. In fact, we say the greater curvature, and you know, right in here is the lesser curvature with those mesenteries coming, you know, off of there. That's where because that's where the liver pouches off. But so greater curvature, lesser curvature, and you'll find the spleen along the greater curvature of the stomach. On the pig, the spleen, you know, is a very elongated thing. In humans, it's a little bit more of a compact organ, but that's what you're looking at. So you come from that cardiac region of the stomach down to where it dumps into the C of the duodenum. So right there, there's the C of the duodenum on the left, on the right upper quadrant. And of course, you have to lift the liver up to see these things. The C of the duodenum. And that junction between the stomach and the duodenum would be the, anybody remember?
Pyloric valve.
Pyloric, right? Pyloric sphincter, pyloric valve. And of course, that's where that chyme enters into the duodenum. And then what you'll also see on the underside of the liver, there's the gallbladder, the little floppy sac. Remember, it doesn't produce the bile. The bile gets produced by the liver, backs up into the, or, you know, flows into the gallbladder, and then after a meal gets compressed out of the gallbladder through, see the duct that connects? If you follow it down, it will connect right here where the stomach meets the duodenum. And that's also where, if you look in the C of the duodenum, there's the head of the pancreas. See the grainy tissue in there in the mesentery with the tail of the pancreas going back this way.
Oh, yeah.
Head of the pancreas, there's the C of the duodenum with the head of the pancreas and the tail. Tail, it like points right back at the spleen when you put everything in position. Everybody get to see that?
No. Can you sit back down?
Yeah. the C of the duodenum, there's the stomach. I lifted it up. J of the stomach, C of the duodenum with the pancreas, its head nestled in that C, and the tail going back towards the spleen. And you can also just see the gallbladder right there with its bile duct. It would come down here and enter with the pancreatic duct You know, you can't see those ducts because they're in the head of the pancreas. I mean, they're literally in the tissue of the organ. Okay?
Okay.
And then the rest of it, you know, there's not that much to it, you know. And the truth is, the pig, large and small intestines are very different than humans, so we just look at this as, you know, small intestines here. And then for humans, our plastic models, I think, are not that great either, so just know this. You get that jumble of small intestines, you know, kind of centrally in the abdominal cavity, and then they all come down in us to the lower right quadrant. And that's where the small intestines unites with the large intestines, and there's a little pouch coming off the large intestines called the cecum, with what's called the appendix, or vermiform appendix, a little worm-like piece extending off of it. That cecum and appendix harbor a lot of beneficial bacteria that help with the digestion of our food. But of course, we know that that appendix is very thin-walled and vulnerable to getting inflamed, or appendicitis, which, if it's not treated, normally surgically, can then actually burst open, and then you go from having a pretty simple matter of removing the appendix to having the contents of the gut spilling out into your coelomic cavity, and it has to be lavaged or washed out, and it becomes a, you know, antibiotic washes and treatments is a much more complicated procedure. So that's why we worry so. And you know, for whatever reason, it's not you know, I don't anybody know 1-2% of the population has their appendix removed.